All right. Hey guys, it's Jenny on the block, and I am excited to be here today. I am talking to Dr. Hansen from Summa Health, and we are talking about seizures. There's a lot of misinformation that goes on out there. So Dr. Hansen, thanks for being here and talking to us a little bit about this topic.
Thanks for having me, Jenny. I'm glad to be here.
All right, so let's jump into it. You're a neurologist, so you study the brain, is that correct?
That is correct.
Okay. So what can cause someone to have a seizure?
So that's a great question. So in particular, I'm not only a neurologist, but I specialize in epilepsy, or a condition in which people's brains cause seizures. And so when we think about seizures, a seizure is an electrical abnormality in the brain that causes somebody to lose awareness and usually fall on the floor with shaking and jerking and unresponsiveness. And when we think about the different things that can cause that, it can be a variety of things that happen in our day-to-day lives. It can be increased stress. It can be trauma if somebody has a major head injury. It could be issues with their chronic medications if someone's diabetes or high blood pressure is out of control. Or it could be something as simple as they're born with a genetic condition that predisposes them to have seizures.
Okay.
And sort of to that end, I think about epilepsy as this chronic condition that we treat with people who have brains who are predisposed to have this abnormal electrical activity that causes seizures.
Okay, so you mentioned a lot of different things that could cause a seizure. What is the difference between an epileptic seizure and a non-epileptic seizure?
Yeah, so we get this question a lot, and I like to talk to my patients and tell them that I think you should view seizures as having sort of two flavors. One is the epileptic seizure, and when we say that as doctors, what we mean is there's an electrical seizure happening in the brain at the time of the seizure. And those types of seizures, like I said, have numerous different types of causes. And there's something that, we need to do a formal sort of epilepsy workup in order to figure out the cause of. And those types of seizures in particular are best treated with seizure medicines that sort of calm down that electricity in the brain. Whereas the other type of seizure, non-epileptic seizures, it's a little bit less known what the true underlying cause of those is, but they're basically sort of a sudden onset of brain dysfunction that we often think are tied back to stressors or sort of psychiatric issues that go back even as far back as childhood. And those type of seizures are very much just as equally jarring as the epileptic seizures, and patients do not have control of them. And so we have to treat them and evaluate them the same way. The treatment is a little bit different, though, than the epileptic seizures.
Oh, okay. All right. So if I see someone who's having a seizure, is there anything that I should do as a bystander? I've heard some really weird things. Like I think I told you before we started the call, I've heard you don't want them to swallow their tongue. You should stick a wallet in their mouth. And that doesn't sound right. So I'll let you answer, doctor.
Yeah, I hear this all the time. And, what I tell people is that with seizures, what you want to do is, and I don't know if we lost audio there. We didn't lose audio, did we?
No, we're still good.
Oh, okay, good. My phone was ringing. So anyway, so what I like to tell people is with seizures, what you should know is that most seizures are going to stop within 2 to 3 minutes of starting. Mm-hmm. And so the thing you want to do is sort of step back and make sure the person who's having the seizure is safe. Meaning that if they're in an environment where there's dangerous objects around or things that can get in the way and cause them harm, you want to move those objects away. You want to stick with the person until the seizure is over and just make sure that they're able to get their breaths and that they're breathing okay. They won't swallow their tongue. There's no reason for you to put anything in their mouth.
Okay, good.
And actually, that's a safety thing because if you put like a wallet or something in your mouth, there's a chance that the seizure is causing them to bite down really hard and it can actually harm you in that moment. And so I tell people, again, 2 to 3 minutes, it's going to stop. Now, afterwards, I like to tell people that, think of your brain like a computer. And after you sort of unplug and replug in a computer, it has to reboot. It takes a little bit of time. And that's what you'll see in somebody who's had a seizure. They're going to be confused. They're going to be a little bit groggy, but ultimately, they should gradually recover to their normal selves within 5 to 10 minutes, sometimes a little longer.
Okay. And then just out of curiosity, do they remember the actual event itself once it's done?
Yeah, so that's a great question. Honestly, there's a variety of different types of seizures and symptoms associated with seizures, but pretty much any seizure that results in somebody having complete loss of awareness or shaking and jerking will cause them to not remember the event. And often you can ask the person right afterwards what happened, and they won't be able to tell you other than, hey, I don't know. I lost that period of time. Most patients that we see in our clinics to treat for seizures often know they've had one because they feel sore or tired afterwards, but that's really the only symptom that they experience from the seizure. And to that end, I was going to throw in, if you're there watching somebody have a seizure and they aren't recovering to their normal selves, or they hurt themselves in the process of the seizure, that's when you should call 911 and get the paramedics there to help you out. They have medicines that can help prevent and stop seizures, and then they can get them to the emergency room where they can get the care they need.
Okay, so let's jump into treatments, because obviously if someone is suffering from seizures, whether it be epileptic or non, what are the treatments, especially that Summa Health is, what do they have out there?
Yeah, so if someone is having seizures, the first thing I want them to do is they've got to go see a neurologist, and ideally somebody like me who's got to focus on seizures or epilepsy training, because it's really hard to make the diagnosis of not only seizures, but also epileptic seizures. And it requires a lot of advanced testing. We do it, the most common and the best test we do is called an EEG. It's short for electroencephalogram. We put electrodes sort of on the head, and we look at the brain waves, and we look for abnormal electrical activity or even seizures with that test. It's kind of boring. People tend to fall asleep and relax during it, but it's a very helpful study for us to get, and kind of helps us figure out the types of seizures the patient is having. And from that point, we then look at causes of seizures. Do they have maybe a brain abnormality that they were born with, sort of like a birthmark on the brain? Do they have genetic causes of the seizures? Is there some other reason that they're having these seizures? And then, then it kind of pivots to, depending on the type of seizure, whether it's epileptic or non-epileptic, what is the best treatment method?
Okay.
And so for the epileptic treatment seizures, what we typically use are anti-seizure medicines. People may have heard of some of these in the community, like, for example, Keppra or Lamictal. I'm using brand names here for the pharmaceutical companies, but these are common medicines that we use because they're very well tolerated. And the goal of those medicines is, again, they're going to calm that electrical activity down in the brain to prevent seizures. And, the vast majority of people with epileptic seizures, they will be on one or two medicines and their seizures will be very well controlled. In the event that they continue to have seizures despite medicines, we have a lot of different treatment options now available for people, including medical devices like vagal nerve stimulator, as well as epilepsy surgery, where we can go in and look at what areas of the brain are not functioning appropriately and maybe do some type of procedural care for them.
Awesome.
And then that's the last thing I want to comment on is the non-epileptic seizures. I know I've said a lot, but the non-epileptic seizures are treated a little bit differently. So because those often have causes or underpinnings related to person's prior traumas or their psychiatric issues that they're dealing with, we use this gold standard of therapy called neurobehavioral therapy, where we put them through sort of a 12-week course where we explore the causes of the seizures, the triggers of the seizures, and how they can work to prevent them and control them. And it's usually met with great success.
Wow, that's awesome. I had no idea that you treated seizures differently based on if it was epileptic or non. So very interesting stuff, Dr. Hansen. And if you guys are interested, you can get more information. Go to summahealth.org/epilepsy. You can also call 234-867-6970. So Dr. Hansen, thank you so much for being here. And if you guys have questions, make sure you check out Summa Health.
Absolutely. Thanks for having me, Jenny.